Like most Americans, I always took health insurance and healthcare for granted. And I, like most Americans, failed to understand the vast complexities of U.S. healthcare delivery and financing. I've been insured for as long as I can remember. I'm what you would consider white-collar middle class. My son was born in 2003, Thomas. He was diagnosed at birth with severe hemophilia, a genetic blood clotting disorder requiring a lifetime of medication to manage and prevent death or serious disability. Thomas was special, but because of this, he became what I consider a canary in the coal mine of healthcare. When Thomas was a year old and after approximately 6 months of expensive treatments and medications, our company went to renew their insurance and were shocked to find out that premiums were going to be unaffordable for the company. Because of the previous claims and because we fell into a large group insurance category, no other insurance company would touch us. It's not only been a burden for myself, but with what my coworkers have had to deal with increased premiums, increased deductibles, increased out-of-pocket expenses. Coworkers are now rationing their own care. If they get sick, instead of paying out of pocket to go to the doctor, they wait and see if it'll clear up on its own. Our premiums still went up almost 20%. And the only reason they didn't go up higher was that they introduced a $1 million lifetime cap. In 2005 and 2006, the cost for the care for my son was $750,000 a year. Changes like these that the insurance company uses to weed out the chronically ill so that they can cover the most healthy people and make the most profits. We are about a month or two away from hitting the cap because no company wants to endure a $1 million liability. Medicare and Medicaid have also been options we've looked into, but I make too much money. Social workers have even suggested, in exploring all of our options, a paper divorce, because if my wife with no income and children would make it easier to get on Medicaid. With nearly a third of healthcare dollars going to administration expenses and insurance company profits, current plans on the table, except for HR 676, don't address the real problems. They don't work for individuals or employers, the chronically ill, the working poor, the middle class, small business, or the rest of America. My employer's premiums have skyrocketed since Thomas was born. The only private coverage available to our company today has a $1 million cap, which Thomas will exceed in a few months. The only health proposal that doesn't bankrupt families unfortunate enough to face serious illness is a single-payer national health plan.